Public health is so much more than just vaccines and clinics. It's ensuring that the foods we eat are safe, addressing community health needs following a hurricane, assessing the impact of violence on child development, and coming up with ways to reduce community violence. Public health is about exploring why residents in different zip codes within the same city have such different life expectancies, seeking sustainable solutions for health inequities in low and middle income countries, encouraging healthy behaviors that will keep the spread of infectious diseases low. Public health is about making the world safer and healthier, day by day, from family to neighborhood, from city to state, and across countries and continents. And our faculty are fierce advocates in this effort. They conduct timely, creative public health research that impacts communities worldwide. And as educators, we expand our work by training the next generation of public health professionals, preparing them to address the next pandemic, the next disaster, the next health crisis. We were the first school of public health established in the United States, and we take that leadership role seriously. We are public health innovators with an eye on what's next. It's our mission to ensure equitable health and well-being for everyone. One of the features of the school that's really important is the fact that we are in the Gulf South. This has been the epicenter for health inequities in this country, both historically as well as today. And there really aren't any other schools of public health that is focused on this region. My office is just outside the foot of the Mississippi River. And so it's a constant reminder that we live in a region that is suffering from many of the health inequities that we talk about a lot in this country. So we focused the school on these topics. We want the school to be a place where we are studying, where we're developing programming, and where we're demonstrating that we can have an impact in creating a more equitable society. And if we're going to do that for this nation, it's going to have to come from the South, because this is the driver for the inequities. We want to be that institution that moves this health equity issue forward. We've got projects with a variety of partner organizations here. We work very closely with the city and state government with managing the COVID pandemic. We're working with the Ashe Center, where we are training culture bearers, musicians and other artists, to become health educators, so that as they go through their travels, they are educating people about positive health messages. We're working closely with the city on violence and also mitigating the impact of violence on the population. Mosquito management, which is really important in terms of disease transmission. We work very closely with the Vietnamese community in New Orleans East on a variety of public health issues out there, as well as working with West Jefferson Hospital in the development of the new Center for Hispanic Health that they've established there. One of the most critical problems we have in public health is that we create new programs and we use grant funding and actually demonstrate that these programs can have an impact, but there's no sustainability because of the nature of grant funding. If we can learn how to bring more entrepreneurship into the work of public health so that programming can be sustainable over long periods of time and improve the health of the population, this would be an important advance for the field. Climate change is an existential threat to humanity, and Louisiana is in one of the most fragile locations on the planet. So I look at our community as a place where we foreshadow what we should expect to happen in other parts of the country and the world. We're developing programming around climate change and health. We're recruiting new faculty, and we're developing a new program to train a new generation of researchers to address climate change and health. We're fairly unique in the sense that we have both a local and a global mission. We're deeply embedded in the city of New Orleans, but we're also very active across the planet. Reproductive health issues in the Democratic Republic of Congo. We worked with the government of Ethiopia to write the program for their electronic medical record that the nation uses. We've had a huge impact in countries like the Dominican Republic, where we've been working on intimate partner violence. And a faculty member that is permanently located in Peru, where she's been working on cervical cancer for many years. These are just examples of the many things that we're doing, both here locally and globally, to make sure that our school is an important corporate citizen of this community and an asset to help improve New Orleans and the state of Louisiana, as well as having a national and global impact. We are the first school of public health founded in the United States, and we're very proud of that. But we don't only look back at that history, but we also look forward. When we move into the charity building, it's going to really be transformational for the school. I think this will create better educational spaces for our students, better studio space for a number of the activities that we do, and I think it'll just give us a facility that will allow us to improve the quality of work that we do and do even more. Significant challenges lay ahead for public health, but we envision bold research and action to ensure that all of humanity has an opportunity to be healthy. And I believe that the Tulane University School of Public Health and Tropical Medicine is uniquely situated to answer the call, to create a safer, healthier, and more equitable place for all. We invite you to join us in this effort. Together, we all hold the future of public health in our hands.